Okay.
So, to start off, I just wanted to express my appreciation that you're taking upon this interview and giving us your time of day in order to help answer these questions about your career.
Absolutely.
And as you may know, we plan on posting this interview as a video on our website, and I need the express written consent of everybody we record in these videos and everything that we upload. And we plan on uploading them publicly to a website and a YouTube channel so that students can have easy access to these informational videos. Do you give your consent and permission for us to do so?
Yes, absolutely.
Thank you. Great, so we can get started now. The first question I have for you is, can you briefly introduce yourself and what you do?
Sure. So I'm Dr. Kristen Casey. I am a licensed clinical psychologist. I work in private practice. I'm also a career coach and a business consultant for other people who are looking up to open up their own practices. What I basically do is I do teletherapy and psychodiagnostic assessments. Before COVID, a lot of times people would meet, in an office, and I realized that it's a lot easier for people to feel comfortable through telehealth. So I conduct video and phone sessions now. But I did my doctorate at Midwestern University in Glendale, Arizona. You might hear my dogs. I'm sorry.
It's okay.
They might have felt this. Working from home. Yeah, so I worked in a hospital. I worked in inpatient settings and things like that too. So yeah, that's basically what I do.
That's a, seems like a lot. Very impressive.
Yeah, thank you. It's fun. I love it.
I understand that there are many different fields of psychology and that clinical psychology is a large area of expertise. Can you help emphasize the difference between being a clinical psychologist versus being a general psychologist?
That's a really good question. So I think a lot of times there's a misconception about, clinical psychologists and other psychologists. So when you go through a doctorate program for psychology, clinical psychology, you become a generalist clinical psychologist. After that, you could specialize in anything that you want to specialize in. But in the field of clinical psychology, there are different specialties. And then outside of that, you could do other sort of things. You could be a school psychologist. You could become an industrial organizational psychologist. You could become, a professor at a school. You could technically still be a clinical psychologist, but there are different fields relating to psychology. A lot of times when you're a clinical psychologist, you could do a variety of things. It means that you're licensed to provide, therapy services or assessment services. So depending on your specialty and things like that, you usually provide, one-on-one services or group services. School psychologists, for example, this is just an example of a different field. They work with schools, so they're working with children or high school students, things like that. Industrial organizational psychologists, they work with companies. So they help the culture of the company. They really focus on ebbs and flows within the office and making sure people are getting along and not arguing. So those are some quick examples.
Okay, thank you. Um, how did you enter this field of work and what specific features drew you in? In other words, how did you know that this was a job for you?
Oh, good one. So I'll briefly explain my journey. It's on my YouTube channel as well, but basically I was a EMT for a while on an ambulance. I volunteered as an emergency medical technician right outside of high school. I was about 19, 18 or 19. And I thought I was going to become a physician. So that was my actual career path. I wanted to become a physician, a primary care physician, and open up my own practice. As I was on the ambulance, I realized I really, really enjoyed listening to people's stories and really helping them through crisis stuff, mental health stuff, if they're experiencing anxiety or depression or, suicidal ideation and really tough stuff. So I decided, hey, maybe I should become a therapist. So when I was looking at schools and, just looking at all the different criteria that you need and all your grades and all of that, I finally settled on a doctor of psychology degree. To be honest with you, it wasn't in my life plan. I really thought I was going to become a physician. So to be honest, I took a little bit of a hiatus to figure out exactly what means a lot to me. And for me, it was human connection. So on the ambulance, I did notice that I was really connecting with other people in a very vulnerable state. And I really wanted to do that for people long-term to help them recover from things. And that's kind of how I started.
That's good. I liked your story about how that this wasn't your first choice career, and I think a lot of students can relate to that.
Yeah, I mean, it's okay to not have it figured out. I certainly didn't.
Is there anything you would recommend to students who are just starting to enter this career path, things that they should know?
Yeah, so in terms of working in mental health, one thing that I did not realize is the amount of burnout and therapy that mental health therapists need. So we're not immune, just because we have degrees in it, we're not immune to any of these things. And I wasn't prepared really to be on my own mental health journey really along the way. And I think that's something that a lot of times mental health therapists are, they don't want to be vulnerable and talk about those things, but it's very real. So when you're able to heal yourself and work on your own things, you're even more equipped to help other people because you're doing the work yourself. You know what it's like to be in the therapy chair. You know what it's like to be a client. But if you don't do the work, sometimes it's really difficult to really see where your clients are coming from. That at the same time, some people have done their work up until then, so you might not need it. But really taking a step to really understand where you're at, and if you need any help before you get into the field, that's really important. Otherwise, you'll mostly learn a lot of these things when you're out on the field. One thing I was really focused on was, oh, are my grades okay? Am I going to pass all these tests and things like that? And I don't know if this is okay to say, but C's get degrees, right? Like if you pass, you'll get there, right? And the only thing that you need is really to pass. And once you're out there, you could always hone in your skills. You could take more continuing education credits, so you don't have to have it perfect. And that's one thing I wish somebody told me back then.
I think that's really good advice for students.
Yeah.
Yeah. Um, can you explain the type of education required in order to be a clinical psychologist?
Sure. So what I did was, well, technically you need a bachelor's degree and then a PhD or a PsyD. And then you have to do an APA accredited internship. And in some states, a postdoctoral fellowship or just supervised hours. So for my journey, I actually started in community college because I wasn't sure what I wanted to do at the time. And then I got a bachelor's degree and then I got a master's degree. Again, because I didn't know what I wanted to do. You don't need that though. And then after that, I got a doctor of psychology degree from Midwestern University. And during that time, I had to do clinical hours for my internship. So you have to match at an internship site, which sometimes requires you to leave the state and go somewhere else. So there might be a little bit of traveling. I always like to let people know that because if you match, you don't really have a choice where you go in some senses because there's only so many sites. And then after that, you get your doctorate degree. And then to get licensed, you'll need a certain amount of hours, a certain amount of, face-to-face hours with clients. And then to take a licensure exam, it's called the EPPP. And it's extremely long and it's really difficult. So if you're a really good test taker, that's great. I wasn't. So I had to do a little bit of training on how to take that exam, but that's overall how to get there.
Just a quick question. Does licensing vary between each state you're in?
A really good question. It does. So for example, in Arizona, where I got my degree, you don't need a postdoctoral fellowship. You could just get licensed right outside of the minute that you graduate, you could get licensed that day if you really wanted to. Where I'm at now in Kansas City, you need postdoctoral hours. Sometimes even other states like California, you might need other continuing education credits before you get your license. So every state varies, but now with COVID and everything going on with the pandemic, they're actually doing this thing, it's called PsyPack. It's an e-passport. So if you have a license in a participating state, then you get reciprocity in all those other states. So right now I think I have 14 licenses in different states just because of that. So it's great for people wanting care.
Yeah. What would a typical work week or work day look like for a clinical psychologist? Is working overtime common? If so, what do you do that requires you to work overtime?
Good one. So it depends where you work. So clinical psychologists can work in a variety of settings. So I currently work in private practice. So this is my office. I work from home and, I make my own hours. So clients contact me for therapy or psychodiagnostic assessments. I schedule them when it's convenient for them and me. When I worked in a hospital for about 3 years and I worked 40 hours a week. And I didn't really have to work overtime. If I wanted to, I could, but it was kind of discouraged because of burnout. So it really just depends on where you work. If you work in a primary care setting, for example, there are psychologists who work in primary care settings. So if you go to your primary care physician and you say, oh, I have depression, and they have a psychologist there, they do a warm handoff and you could talk with that psychologist right there. And really your primary care's office isn't really open that late. However, if you work in the emergency department or ICU or oncology, things like that, you might be required to work different sort of hours or shift work. So it really depends on the setting. I know a couple of people who worked in inpatient settings and they requested to work overtime. So it's not technically required. I guess it just depends on the setting.
It's good to know. What is your favorite part about this job?
Oh, this is such a good question. So I was on a podcast the other day and it was the same exact question. So basically what I love about this job is, well, I'll back up. So I always think it's important to find a job that aligns with your values. And one of my values is human connection. I really like talking with people. I really like listening to their stories. And I really like being a part of their growing process. I think it's a privilege and an honor to do this work. But when I'm in the room with someone, even virtual room, and they're experiencing a lot of pain, emotional pain, anguish, even anger, I just think it's such a vulnerable place to be. And I just see it as such an honor. To be a part of people's journeys, I think it's just to share that moment with someone, I think is amazing. And they're trusting me to do so. So for me, it's the reason why I do this work, because I think all of us really want human connection, right? And we want people to listen and hear us. So in my ability to hold space for other people, I think I also want that. So does everybody else. So I think that's the primary reason why I do what I do.
I love that you're so passionate about what you do.
Yeah, it's so fun. Yeah.
Can you think of any downsides to this career or regrets this career has caused you?
Good one. So let me think. So a downside is that people are really resilient, but they also deal with really hard things. People go through a lot of pain, they go through a lot of trauma. So sometimes it's hard to hear those things. When I was a newer therapist and psychologist, I remember feeling so drained. Like, oh my gosh, like I wish I could just fix these people's problems. So without proper training, it could really get to you. Now that I've been doing it a while, I could kind of compartmentalize, which is good. So that kind of goes into my next point of burnout. My dissertation was on burnout, and we noticed that healthcare graduate students experience burnout at higher rates than other graduate students. So because you're involved in patient care and you're involved in a lot of different facets of these people's lives. So it's really difficult to kind of separate work and school and work and home life. So yeah, I think holding other people's emotional burdens at times could be stressful, but you always have supervisors and peers to fall back on. And then burnout, if we don't really hold on to, our hobbies that we like and all of that, I mean, we could really, really get really drained from this work. So those are the two biggest things that I may have experienced.
It's really good to know.
Yeah.
How has being a clinical psychologist changed you as a person?
Another really, really good. You got good questions today. So I think, to be honest, I think we talked about it earlier of like your own healing journey. So when I'm with people and they're telling their stories and we're kind of using evidence-based treatments to help them grow and help them work through things, I learn from people every day. Just because I've been to school and just because I've done all this work and have 12 years of clinical training, it doesn't mean that I know everything. People will teach you things that you never thought that you knew. So I think it's really changed my perspective on life, and I'm just happy to wake up every day, really. So I think it's really changed the way that I look at the human condition and the way that I look at, people who are upset or angry. They're really just doing the best that they can, but I don't think I would have that perspective if I didn't do the work that I do.
Is there anything else that you would like to let students who are interested in pursuing this career know?
Yeah. So one thing that helped me when I was trying to decide on what to do was to try to figure out, like I said before, like what are your values in life? What do you really enjoy doing? And trying to find a career that connects with that. So if you really like, even if you're an introvert, even if you enjoy, talking with people, connecting with people on deeper levels, or just helping them grow, this probably is the career for you. One thing I will say too is nothing has to be perfect. You don't have to get perfect grades, the perfect exam scores. We're human, and that's okay. You don't have to have it all together in order to be a doctor or a clinical psychologist. And I talk a lot on my social media about this because it's really one of those things where in school we're always saying like, oh, you have to get good grades, you have to be at top of your class and all of that. And that is extremely important to be skilled and to be knowledgeable. And it's okay to not be perfect.
So that's all the questions I have for today. Thank you so much
Okay.
for answering all of them.